All right, we are live from AHS. I don't even quite know what town we're in. Do you? We haven't stepped outside in days.
Minneapolis.
Minneapolis. So, welcome everyone. This looks a little different today as we are coming to you from AHS conference. That's American Headache Society. And we're so excited because this week we're talking about discrimination and migraine. And we are really wanting to talk about how in the world discrimination is still so prevalent. And
Yeah.
so joining me is Dr. Monteith. Tell people who you are in case they don't know.
Yeah. Well, so I am Tesha Monteith. I am a professor of clinical neurology at the University of Miami Miller School of Medicine. I also am the co-chair of the editorial board for the American Migraine Foundation and was recently nominated to the executive
Yes,
board, and I'm
yes.
very happy to be here.
Yeah, thank you. We're so happy. And you are so busy with us and doing so many different things. And we actually did a little makeshift setup here today. So you guys bear with us. We don't know what can happen. This is truly live. So talk a little bit about discrimination and migraine. Like how is this still prevalent in today's age?
Yeah, well, we are humans, so discrimination, unfortunately, is something that persists in society. And so I think stepping back to what is discrimination, and it's really when groups are treated unfairly, differently than other groups. And this could be based on age, this could be based on sex or gender or religious beliefs or race, ethnicity, sexual orientation, a number of factors, disability, we know, and that includes migraine, people with migraine as well. And so it is a real problem in our society. And it's something that there's been not a lot of data, but more recently, more data that's come out on the impact of either discrimination or perceived discrimination in health in general, and with more recent papers also looking at migraine.
Yeah, yeah. So do you think that sometimes it's unintentional discrimination if a patient comes to a doctor and they're asking for they're having headaches or they're having symptoms that look like migraine? How can that show up with a physician that if someone's watching and going, oh, because our goal is not to say, hey, make sure you know you're discriminated against, but hey, make sure you go back and advocate for yourself, right?
Yeah. So I think that just, when we think about discrimination, there's definitely like a kind of a bias that could occur. There could be very intentional discrimination. We've seen that in our society, but there's also unintentional discrimination that happens every day, and that could be related to a number of factors and misconceptions as well. And so it's important to, I think, first taking a step back when we look at marginalized groups, there are at risk to discrimination. And this could be on educational levels, this could be socioeconomic levels, employment levels, different types of levels. So we have our patients coming in that have experienced this. They may have witnessed this, and we know from some papers that even being witness to some of this can impact your health. So, and so those are social factors. And when we think of a condition, many chronic diseases, but certainly a chronic disease like migraine, you have to think about the lived experience of the patient and all that they come in with. And it's not so easy to tease out. And we'll talk about, how we try and mitigate this. In terms of healthcare, certainly discrimination exists in healthcare, and it's something that we need to also take a look at as well.
Yeah. What if somebody is watching and they go, oh, I didn't realize I was discriminated against when I went to my doctor and I was asking for something that could be perceived as pain meds.
Right.
What could someone do to advocate for themselves in the next doctor visit?
Yeah. Well, I think it's important in terms advocacy is very important. It's one of the ways that we can remedy discrimination or the impacts of discrimination to some degree. Some things are really just out of our control as patients, as doctors. But I think that it's important to have open communication. It's important to be informed. It's important to, I think, with all the resources that are available with the American Migraine Foundation, for example, you can be informed on the different treatment strategies. And I think you don't necessarily go in and say, you're discriminating. I mean, there are many factors
Yes.
that might explain why this doctor is choosing this. Some of this may be actually not being aware of certain newer treatment
Yeah.
options and
Which is what we're talking about here. Like,
Ex-
there's so many opportunities that people don't realize.
exactly. And so I think being informed, being part of a supportive group and network is important. And then making sure that you find a healthcare community provider, doctor, nurse practitioner that you feel that you can have an open communication
Yeah.
with as it relates to your lived experiences, but also how you journey through the healthcare system.
I love that. One of the things for people watching that we are doing here at the American Headache Society is just talking about some different avenues that people are seeing discrimination show up or stigma show up, or even just getting care for migraine. And one of the things we've talked about is go to that first visit or go to your annual visit. And when they've only got 15 or 20 minutes to see you, maybe 10,
Yeah.
and they go through, oh, here's your blood pressure. Okay, yeah, it seems good. How's your headaches? They seem fine. Okay, great. How's this? But instead, if you're truly a person suffering with migraine and the headache part of migraine, it's important you go and say they're debilitating 10 days a month,
Yeah.
5 days a month, 15 days a month, and not just because if you don't point that out, I'm learning here this week that if you don't point that out, it's easy to skip over it, go to the next patient, and then you go, oh, I didn't really realize there was a way I could make my headaches or other symptoms go away. Would you say that's the same advice for if you're feeling discriminated against? I love it. You said go in armed and educated.
Yeah.
Like take something, a print off from our website, and it's American Migraine Foundation.org. Take something with you and say, oh, I've done my homework. Like, I have these symptoms. Would that
Yeah.
go a long way?
Yeah.
For
So let me
someone?
have
Yeah.
kind of maybe a bigger kind of example of where we may see unintentional discrimination. We could look at a particular clinic and we could look at certain groups and we can look at the number of prescriptions for migraine specific drugs. And it's certainly been shown that in certain groups that certain patients, those that tend to be under represented, tend to not receive those prescriptions.
Hmm.
And then this is not a fault to any particular provider. I think we see it as a systems-based issue.
Yeah.
And we take large numbers and we start to see patterns. And so what I think the American Migraine Foundation does very well, the American Headache Society does very well, is try to educate doctors, nurses, patients, the whole community, stakeholders, insurers as part of that.
Yeah.
And let them know that people with migraine deserve high quality treatment.
Yes.
That is associated with as little side effects as possible, very high levels of tolerability, and that is highly effective.
Yes.
And so not everyone needs the most newest and the most designer treatment,
Yes.
even sumatriptan. But we even know if we look at something as simple as sumatriptan, not everyone has access to even the basic migraine specific treatments. So I think as a patient, it's important to have that information so that when you are communicating, you may be communicating about some of these therapies that might be more effective. And you may be getting some of these therapies. And I think part of the job is to feel empowered to communicate your needs. And as you say, this treatment is not working. My attacks are still quite debilitating and I need some assistance. So I think that some of these, the impact of discrimination, as we call it, in the healthcare system can be mitigated by education, awareness, communicating in a way that feels safe, but also teaching people what your needs are.
Yes. Yeah. You know, one thing I've learned this week, and I've heard a lot of the clinicians talk about, is go in with a goal. Like say that, you know, if you're having 10 headache days still a month, go in and say, what my goal is migraine freedom, which doesn't mean you can get there.
Yeah.
But a lot of people are accepting that 10 headache days a month is still okay. And that must be as good as it'll get. And so I think the big takeaway for me here is how important it is to arm yourself with that information. Take it into your doctor. I've researched that this is really debilitating for my life. Or bring somebody with you, right? I've heard a lot of you all talk about bring an advocate with you that says, no, honey, you are having 10 headaches a month. Like
Right.
we all know we need that partner,
Yeah.
best friend, whoever to say, let's paint this real picture.
Right.
I feel like that could also be a piece to this, right? That would
Well,
help.
yes, I think everyone has their own way of doing things. Some people benefit greatly from having a supportive
Yeah.
person. Some people find that a distraction, and that's okay too.
Very fair. Yeah.
And some people are very good at tracking their symptoms. You don't need to track absolutely every symptom, but I think some of the basics is helpful to kind of be able to communicate your what we call residual burden of disease, because you may get a treatment and be 50% responding, but that there's still room to have, like you say, go from 20 to 10, but now you're at 10. We're happy you're at 10, but how far can we go?
Yes.
And
Yes.
the
Love
International
that.
Headache Society has come out with a position statement on trying to raise the standards of care for people with migraine. And some of that is, as you mentioned, going from a suboptimal control to optimal control to the potential of migraine freedom,
Yeah.
which is and sometimes a bit theoretical. But I think if we strive for that and we recognize that people with migraine deserve this, right?
Right.
So just because you have a brain disorder does not mean you have to live in devastation with a brain disorder, right?
Yes.
So,
Yeah.
and having migraine is, a condition that can be associated with discrimination.
I was just
And
gonna
but,
say in general, yeah.
because people at times may not be at their full level of function, which can be very, very some places are not so forgiving
Yeah.
for that,
Yeah.
right? And I've heard of people lose their jobs. I've heard of people, so I think that's partly to protect yourself,
Yes.
partner with your doctor, but then there's things like ADA forms, Disability Act, that can be completed. There's FMLA forms if you need to take time off
Right.
while experiencing migraine. So while you're trying to get optimized, there are protections that are available for you
Yeah.
to support you and your journey.
Yes, there's so much. I mean, that is advocacy. Like you've just scaled down a lot of the advocacy pieces that people often have to do for themselves. Thank you so much for that. And for those who are watching, like really and truly, our desire at American Migraine Foundation is really that you are able to get the resources you need. If you're looking for a certain resource and you don't see it on our website, you can always email us at info@americanmigrainefoundation.org. But be aware too, like we don't offer clinical advice. We let the clinicians do that part, but we want to offer patient advice on how you can advocate for yourself. So we want to thank also today, Lundbeck sponsored this week for us. They said, hey, this is important to us. We really want to make sure that people understand how much discrimination is still at play with migraine patients. So thank you so much to Lundbeck. Also, we are revealing hot off the press a documentary that we started 6 months ago. And we actually just have one of the featured guests here. And we're going to be putting the information about that documentary. Actually, it's I don't think you'll get much off my card. We'll put a QR code and information in the chat. We want you to follow that. And if you'll go in and watch it, it's about 13, 14 minutes, but there's 2 questions at the very end, and we really want you to take note of that and answer them honestly so that you can help us show, is discrimination still real? Is this documentary impactful for your life or other people? And please share it as well. So, Dr. Monteith, thank you.
Yeah.
Thank
you for having me, and thank you for, having this discussion, which sometimes is a bit uncomfortable for people, because I think that we want to embrace everyone, and we want people to certainly understand and embrace people with migraine.
Yes, absolutely. Thank you. Thank you for being here. And thank you for being just such a champion for so many of our patients. So, all right. And as everybody knows, this is one of the last, we have 2 more weeks of MHAM. And in case you haven't followed that, that's Migraine Headache Awareness Month. And we'll be back tomorrow as well. We'll be talking with Dr. Starling, Amal Starling, about a similar topic and just kind of keeping in this theme of how we can mitigate discrimination and migraine. So thank you. And thank you for allowing us to have our makeshift set here. We've got a table and a laptop and, and we're making it work. So thank you all. And yes.
And if you're not following us on social media, Follow us
That's right.
on social
Follow us on
media.
social media. So you can get all of those resources, and when they come out, you'll see them too. So, and I love that this is not only live, but you can tell it's clearly not scripted. We have people in the background. So thank you all, and we look forward to seeing you again tomorrow. Thanks, Dr. Monteith.